Health Focus is brought to you by National Medical Stores, NMS, passionate about your life. Cardiovascular disease is a leading cause of death and disability, contributing over 1 million deaths annually in the world. In Uganda, 33 of every 100 people die from non-communicable diseases, with cardiovascular diseases accounting for at least 10% of all deaths. Central Uganda, however, has a prevalence higher than the national figure, 28%. The national figure stands at 26%. This was established through a study conducted by a team from Makerere University's College of Health Sciences, led by the principal investigator, Dr. Geoffrey Musinguzi, under the Scaling Up Packages for Interventions for Cardiovascular Diseases Prevention Program, SPICES.
But what is important to note is that these diseases are as a result of inflammation of the blood vessels, either supplying the head, supplying the heart, or other parts of the body. So the organs that get involved in most cases are attributable to the disease. So if it's the heart, you can have, for example, what they call a myocardial infarction.
This approach involved raising awareness regarding cardiovascular diseases, encouraging adoption of healthy lifestyles, and early detection and treatment of risk factors in line with self-care interventions in the studied districts of Mukono and Buikwe between 2019 and 2020.
In a fairly big population of about 4,500 people, and estimated the burden of hypertension was high. Almost 1 in 4 of the people had hypertension. And then the other thing is that of those who had hypertension, majority were unaware of their hypertension status. But even those who were aware of their hypertension, only about half were on treatment. And about half of those who were on treatment, just about half of those were actually controlling their hypertension.
Betty Namutebi, a resident of Chitola village in Buikwe district, was diagnosed with high blood pressure and diabetes at Kawolo Hospital. She had given up on seeking treatment because of the distance and expense to the hospital.
Otekeko n'amazzi okunywa vaina nayo 10 kuba ga 5 kati akakaaga n'akanaana n'2,000 nembanga zinfulumiza mu byentambula yokka ng'ate waliwo okugula eddagala lisifunye.
Hers and many other factors, including poor health-seeking behavior, are contributors to the problem of increasing late presentation to health facilities for diagnosis.
Namiranga amakerenda gange ngasigamira mu budde. Wenfunidde ekyokulya basaawa nyanga miranya.
But the project also established several challenges at the health facilities that hindered diagnosis and treatment.
Apart from the specialists I complained about, the other staffs to support in the areas of nutrition, in the areas of providing supportive care.
The infrastructure that we have, it makes our triaging a bit uncomfortable, like everybody realized. We're screening here for weight and height, then we're trying to improvise part of the laboratory space for the data. And that's because we have multiple entries. Others may end up, like those are using other departments like maternity, may be missed out on triaging here because of the multiple entries, given that we don't have a fence.
Before SPICES came in, all the blood pressure machines were down. We did not have them. And the ones which we had gone faulty. So what we could do was not to diagnose.
We diagnose many every year, and they are put in a pool. And this pool is getting bigger, yet the budget that caters for their medications and other supplies remains meager. So sometimes we get out of stocks of medications.
For the advanced disease, it is quite expensive. And as I said before, it is better to prevent. Because if government is to provide for every other person, this would affect other essential services.
Dr. Musinguzi says they provided the 23 facilities with diagnosis equipment to enable them capture data.
As a result of this screening, we have actually been able to get some facilities start special days for NCD clients, or some of them have actually established clinics for NCDs, and some of them have actually numbers they follow, and we really think that has been a great contribution of this project.
And even patients have got confidence in us that, hey, now when you go to the health center, they test for diabetes. And many people are coming. For me, I want to be tested for diabetes.
Ever since the onset of the project, everyone who's above 18 years is screened. And we have been able to get cases of hypertensive even in children, which wasn't there previously.
Assistant Commissioner for Non-Communicable Diseases at the Ministry of Health, Dr. Gerald Mutunji, says the data being gathered will be key for decisions like extended rollout.
They are going to give us evidence that if you do these cost-effective interventions, you can actually prevent cardiovascular diseases. They are helping us screen our patients, because most of our patients, of our population, are living with hypertension without knowing. 3, they are helping us treat, because they have even provided some buffer drugs, so that even when ours are out of stock, there is some drug. We need the health workers to appreciate that this is part of their routine work. There's no way you should manage an adult patient of 50 years without measuring blood pressure.
Non-communicable diseases can be avoided majorly by adjusting one's lifestyle through activities like exercising, good feeding, and reduced consumption of excessive alcohol and smoking, which are risk factors. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.